My name is Michael Ford. I'm an independent Medicare broker in Phoenix, Arizona, and this is a 10-minute lesson on Medicare. There's so much confusion around this Medicare stuff, but Medicare is really pretty simple. I'm going to show you in 10 minutes the basics around selecting a Medicare plan. I'm going to break down this guide for you. It's called A Quick Look at Medicare, and it's put out every year by CMS. All the Quick Look at Medicare guide does is give you a high-level overview of your Medicare coverage options. There's a lot of parts to Medicare, but when a person first goes on, really what they're trying to break down is whether they need a supplement or an advantage plan. Medicare, of course, is federally provided health insurance for people who are 65 and older, people under 65 who have qualifying disabilities, or anybody who develops end-stage renal disease, which is kidney failure. So this is how it works. At some point, you should receive a red, white, and blue Medicare card in the mail. If you're turning 65, you should receive it a few months before your 65th birthday. If you're not already taking Social Security benefits, you may want to call Social Security and remind them that you're turning 65. If you're disabled, you'll receive it 24 months after you were deemed disabled by Social Security. This red, white, and blue card is an actual insurance card, so don't throw it away. The Part A is hospital insurance. Part A has no monthly premium if you worked for 10 years or 40 quarters and you paid into the Medicare system. It covers emergency stuff like hospital stays, ambulances, and emergency rooms. Part A has a deductible that must be paid first before the insurance kicks in. Part B covers your outpatient services like primary doctors, specialists, surgeries, labs. Part B has a monthly premium and it has a deductible. After you've met the deductible for Part B, Medicare becomes an 80-20 type of insurance. So in simple terms, Medicare pays 80% and you pay the other 20%. And there's no cap or limit to how much the 20% can be. The bills just keep coming. So if you go in for a $100,000 surgery, Medicare will cover 80% and you're responsible for the other 20%. So what you and I are trying to figure out is how you want to cover the deductibles and the 20%. And notice I haven't mentioned prescriptions, so we'll have to figure out how to cover those as well. There's many different ways, but the guide takes us through the two main ways. The first way is what's called a supplement or a Medigap policy. Supplements are lettered plans like Plan F, Plan G, Plan N, and with a supplement, I keep Medicare as my primary insurance and the supplement becomes my secondary insurance. When you buy a supplement, you pay a monthly premium to a private insurance company to cover some or all of the deductibles and the 20% that Medicare doesn't cover. A Plan F, for instance, covers 100% of what Medicare doesn't cover, while a Plan G makes you pay the Part B deductible first. Be aware that if you're going onto Medicare for the first time after January 1st, 2020, the federal government has decided you cannot get into a Plan F. With Medicare as my primary insurance, I can see any doctor anywhere in the country that accepts original Medicare. There's no network in the traditional sense. Supplements of the same letter plan sold by different insurance companies must offer the same basic benefits. What that means is a Plan G with one company is going to offer the same basic benefits as a Plan G with any other company. If Medicare pays its portion of the approved amounts, the supplement is also going to pay its portion. So if your doctor accepts original Medicare, they will accept a supplement from any supplement company. In some states, you have to be at least 65 years old in order to enroll in a supplement though. With a supplement, I know my fixed costs. I pay my Part B premium every month, I pay my supplement premium every month, and I know how much the supplement is going to cover for me. Now, neither Medicare nor the supplement cover your prescriptions. So if you decide that you need prescription coverage, you can add a standalone prescription drug plan. This is Part D of Medicare. The Part D can be another $20, $30, $40 per month or more, depending on the plan that's most appropriate for you. If you're only taking a few generic prescriptions, it's pretty easy to pick a plan, but the only accurate way to determine which plan is going to cover all your drugs and be most cost effective is to go on Medicare.gov under the prescription drug finder, You plug in your prescriptions and let Medicare tell you which plan is right for you. If you want help with that, email me. If you didn't sign up for prescription drug coverage when you were first eligible and you don't have any other coverage that Medicare deems credible, Medicare will give you a penalty if you try and sign up in the future. So that's the first option: original Medicare with a supplement and standalone prescription drug coverage. The other option is what's called a Medicare Advantage plan. This is Part C of Medicare. Advantage plans are run through private insurance companies. It's all the big names that you see on TV all the time. Medicare Advantage plans are typically like HMOs or PPOs. What they do is they combine Part A and B, and usually Part D, all into one. If you enroll in an Advantage plan, instead of Medicare being your primary insurance, the Advantage plan becomes your primary insurance. You never lose your Medicare and it never goes away, but instead of Medicare paying the bills, the Advantage plan starts paying the bills. All the services that are covered by the red, white, and blue card must be covered by every Advantage plan. In very competitive counties, it's not uncommon for companies to offer Advantage plans with no monthly premium. If you choose an Advantage plan, you still have to pay the Part B premium for the red, white, and blue Medicare card every month. The way most of these plans work is you pay co-pays or co-insurance as you go. So my primary doctor might be $0 or $10. My specialist might be $20 or $30. Surgery would have a copay. Ambulance ride would have a copay. Advantage plans are more of a pay as you use it. If you choose an Advantage plan and it's an HMO, you have to use doctors who are in the network. You're going to want to verify that your doctors are willing to accept the Advantage plan you enroll in. Usually the prescription drugs are built into the plan, but not always. So if you need prescription drug coverage, you're going to want to verify that the plan offers prescription drug coverage. Advantage plans also have the option of covering some of the services that Medicare doesn't cover, like vision, hearing, dental, etc. No monthly premium? Mike, that sounds a little suspicious. I get a lot of skepticism around the no monthly premium aspect of Advantage plans. So what happens is when you become the member of an Advantage plan, Medicare pays that plan every month to take over administering Medicare's benefits. So just because a plan has no monthly premium doesn't mean it's a cheap option. It just means that the company doesn't need to charge you anything more to cover the costs that the plan incurs. So if I choose an Advantage plan with no monthly premium and I don't use any medical services for the year, I don't pay. The costs of an Advantage plan are going to be different in every county. In my county, it could be $0 per month for an Advantage plan, and the county right next door could have a premium for the exact same plan. If you join an Advantage plan, you cannot use or be sold a Medicare supplement policy at the same time. It's either one or the other. At this point, my clients will usually ask, well, which is better? And there really is no better. And Medicare doesn't like me using that word, but there's going to be a plan that's more appropriate for your individual situation. And that's pretty much it. There's a few unique situations outside of that, but that should cover most individual circumstances. So I hope that makes sense to you. It's really not all that confusing. And if you're not working with anyone and you're in Arizona, give me a call or shoot me an email. I'd be happy to get you all squared away, and I get paid from the insurance companies, so there's no cost to sit down with you. Good luck.